So you can use high dose ivermectin for, majority of cancers. And now this is a dose that's about 5 to 10 times the dose that people were using for COVID-19.
So you're talking about like 10 milligrams, 12 milligrams per kilogram of weight?
No, so ivermectin, I'm talking about 1 milligram per kilogram. So for a 60 kilogram person, the starting dose for cancer would be 60 milligrams. That would be five 12 milligram pills, for example, right? Now for COVID-19, people were using, 6 milligrams, 12 milligrams. Here you're looking at 60 milligrams per day, right? So it's a bit of a higher dose, but there's tremendous in vitro and in vivo evidence. There's dozens of studies that have looked at ivermectin and cancer. The reason why they're not using it right now, or why it's not in trials right now, is it's off patent. You can't make money off it. In fact,
no, and I was just going to say, this is why, in terms of public policy, and I've been advocating this in the states don't spend as much money as the feds, but we don't have control there. Take a portion of your cancer funding that all of them have and give grants exclusively to off-patent repurposed drugs. We need to know the combinations, the types of cancers, the dosage to take this to the next level. And automatically it takes the politics and the game out of it, because there's no money there. So if you have an entrepreneuring scientist that cares more about the science and saving lives, they just need money, and you're spending government money on it anyway, at least put a portion into that. But go on about what you're seeing with the results and studies for ivermectin and mebendazole.
And I'll tell you very quickly why Merck abandoned ivermectin, which it used to have a patent for, and why it basically smeared ivermectin during the early days of COVID-19, saying, look, it doesn't work for COVID-19. And people were surprised. Why is Merck bad-mouthing its own drug? Shouldn't it be trying to, make more money off its own drug? Well, Merck is in a 50-50 partnership with Moderna for the new mRNA cancer vaccine. That right now there's clinical trials in Australia. They're doing trials, phase 3 trials on this new mRNA cancer vaccine, and Merck is going to get 50% of the profits because they have a partnership with Moderna on this new mRNA cancer vaccine. It's all about money. In the end, it all comes down about money. That's why you don't have any clinical trials for ivermectin, high-dose ivermectin. That's why you don't have any clinical trials for mebendazole or fenbendazole. Now, interestingly, with fenbendazole and mebendazole, is it increases p53 levels,
which the vaccine down regulates.
And this is one of the theories of how the vaccines might be causing the cancers, is that the spike protein interacts with p53. There's research on this, and that it either damages the p53 gene or downregulates p53. So this repurposed drug, again, an antiparasitic, fenbendazole, is not approved for human use, but some people are using it. There's a gentleman called Joe Tippins who cured his stage 4 lung cancer. They sent him home to die. He got fenbendazole from a veterinary friend of his, and he cured his stage 4 lung cancer. So some people are using it because of that story. Mebendazole is the FDA approved version. You can use that with no issues of because it is approved for humans. It upregulates p53 levels. And so this is something that you're not going to get from standard treatments. You're not going to get chemo upregulating p53. You're not going to get radiation therapy upregulating p53. And this is something that people who've had COVID vaccines may need. They may need an upregulation of their tumor suppressor p53 protein.